Gestational diabetes is known as glucose intolerance that is first detected or diagnosed during pregnancy. In India, 1 out of every 4 pregnancies is affected by GDM. And though it is a GDM is a transient condition, it can lead to, in the long run, it can lead to long-term health risk for both the mother and child, including heightened risk for developing type 2 diabetes mellitus postpartum. So our main aim was to determine the prevalence and associated factors of prediabetes and type 2 diabetes in women with history of gestational diabetes mellitus when compared to women with normal glucose tolerance during 1 to 5 years post next pregnancy, following up in a tertiary care hospital in South Kerala. Primary objective was to estimate the prevalence of prediabetes and type 2 diabetes, and secondary objective was to find out the associated factors. This was a comparative cross-sectional study conducted over 1 year, and the study included 2 groups of women, 1 to 5 years postpartum, those with a history of GDM and those with a history of NGT during pregnancy. Women with pregestational diabetes, medication-induced hyperglycemia, and current pregnancy were excluded, along with those who did not consent to participate. And sample size was taken 60 participants per group. And data collection involved reviewing the hospital records, obtaining informed consent, and administering questionnaires. And we have checked for their height and weight, and blood pressure were recorded. Blood samples were analyzed for HbA1c and fasting plasma glucose, and diagnosis of prediabetes and type 2 diabetes was done according to ADI guidelines, and statistical analysis was performed and analyzed using appropriate statistical methods. And results are like we have prediabetes was found to be 41.7%, and type 2 diabetes was found to be 16.6% in GDM group, and prediabetes in NGT group was found to be 23.3%, and there was no type 2 diabetes in NGT group. And if you see, based on the HbA1c values alone, GDM group had 30% of prevalence of prediabetes and 13.3% of type 2 diabetes, and NGT group had 11.7% of prediabetes, and there is no type 2 diabetes according to HbA1c values. And based on fasting plasma glucose values, GDM group had 30% of prediabetes and 15% of type 2 DM, and NGT group had 18.3% of prediabetes. And we assessed for the multivariate analysis has shown that GDM in itself and family history of type 2 DM and present BMI more than or equal to 30 was found to be significantly associated with the prevalence of prediabetes and type 2 DM. And we have checked for univariate analysis to independently assess for the risk of the variables, and GDM and family history of type 2 DM were found to be significantly associated. And we can see when we compare our results with the other studies, Goel et al. Was more comparable to our study, and Shivasri et al. The prediabetes and type 2 diabetes differs from their study. And if you compare our study results with the Indian and global prevalence, it is way more than the Indian and global prevalence, both the prediabetes and type 2 diabetes. And if we assess the individual risk factors, GDM in itself had a 4.2 times higher odds of developing prediabetes and type 2 diabetes, and it was substantiated by the studies by UH et al. And H. Herath et al. And family history of type 2 diabetes in GDM women was found to be significantly associated with the prevalence of prediabetes and type 2 diabetes, and these findings are similar to the Choi MJ et al. And E. Nocter et al. And though some studies like Hasbullah F. et al. Has indicated that parity is linked with high parity with the early development of AGT, our study did not show any significant association between parity and the prevalence of prediabetes and type 2 DM. And we have also seen that current BMI and pre-pregnancy weight with the association, but E. Nocter et al. And Songsi et al. Established a link between higher current BMI and increased risk of prediabetes and type 2 DM. But in our study, only overall population only we have seen the higher current BMI association with the prevalence. But in GDM women, whether it is less than 30 or more than 30, the rates were similar. And recent research by Bagde and et al. In Central India emphasizes that pre-pregnancy weight was associated, high pre-pregnancy weight was associated with more prevalence of prediabetes and diabetes, but this study did not find any significant difference in prevalence based on the pre-pregnancy weight. And duration post-delivery, Denison R.A. et al. Has reported 12% annual increase in type 2 DM, among women with a history of GDM, but our study did not observe any significant difference in prevalence based on the time elapsed since delivery. But most important thing to note down is that as early as 2 years post delivery, some women are progressing to uh, develop prediabetes and type 2 diabetes. And conclusion, these findings highlight the increased prevalence of prediabetes and type 2 DM in GTM women 1 to 5 years postpartum, and this contributes to the growing body of evidence emphasizing the long-term consequences of GTM, underscoring the need for sustained postpartum monitoring and proactive management strategies to mitigate the risk of future metabolic complications in this vulnerable population. And further research, especially longitudinal studies with large sample size in various populations, is needed to understand the complex interplay of associated factors to recommend the effective screening strategies and to initiate early intervention in these women. Thank you.